We're going to do a palpation of the lung channel, feeling for specific anatomy associated with this channel. So I'm going to start at the arm, along the lateral edge of the biceps. I'm just going to notice that there's a little valley there where you fall off the lateral edge of the biceps and fall into a space. We'll come back to what that space is in a little bit and what's deep to that space. But we'll follow that space to the cubital crease at the elbow at an acupuncture point, lung 5. So if I flex my elbow, I can feel the biceps tendon. I'm on that radial side of the biceps tendon, lateral side of that biceps tendon. And I'm going to start to press into that tissue, kind of following deep to the biceps. And I'm going to strum lateral to medial. And I'm going to notice that there's a deeper structure that's wider. And that's the brachialis muscle. Brachialis muscle is a little bit shorter, covers about half the arm. It only does elbow flexion versus the more superficial biceps that crosses the elbow joint and the shoulder joint. So it does movement at the elbow and does movement at the shoulder. So we're at a deeper muscle, and that's the brachialis. Halfway up the arm, we're at the distal portion of the brachialis. So I'm going to strum lateral and medial. Notice the density of those fibers might be a little bit sore, maybe associated with some elbow pain that you have. There's also an artery and a branch of the musculocutaneous nerve that I might be strumming through. So I'll just take note of that area. All right, from here, I'm going to start working down the forearm. So I'm going to follow another space, another groove, another little valley. And I'm going to follow that valley down to the wrist at an acupuncture point, lung 9. So let's look at this valley now. So if I go across a tendon towards the ulnar side, I'm strumming through flexor carpi radialis. Flexor carpi radialis is going to go from the wrist, actually from the fingers, but from that region I was palpating to the medial epicondyle. But there's a pretty solid, noticeable border as I press into that flexor carpi radialis. I can feel the density of it. I can feel when I'm off it and more along that lung channel distribution at the radial side. But that kind of wall that I'm strumming across of the flexor carpi radialis is there and it's present, very obvious. So I can work up. I'm still at the edge of that flexor carpi radialis, despite the fact that it's going to the medial elbow. I'm kind of following up the space towards lung 5, towards that lateral edge of the biceps. Why? Because there's another muscle on the radial side, brachioradialis. So brachioradialis is part of this big mobile wad of 3 muscles here, which are kind of 3 groupings of muscles that are easy to move on your forearm. I'm on that medial kind of anterior aspect of the brachioradialis. So I can feel flexor carpi radialis this way, brachioradialis that way. I'm in this obvious groove between those. And as I get closer to the elbow, I kind of particularly follow the brachioradialis up to lung 5. Let's go back and let's look at what's deep in that valley. So deep in that valley, I have the borders, the walls of it that I just mentioned, flexor carpi radialis, brachioradialis. But deep in that valley, I have the radial artery. In the proximity of the radial nerve, it's going to be a little more under the brachioradialis muscle itself. But I'm in that general region, but I'm also close to another muscle. So if I go deep in that valley, deep to the flexor carpi radialis, deep to the brachioradialis, kind of close to the radialis bone, and then I flex my thumb, flex the interphalangeal joint. I'll feel flexor pollicis longus. Flexor pollicis longus is going to run up much of the arm. And as I press deep into that valley, I'm definitely touching flexor pollicis longus. Eventually that muscle is going to end. And as I continue deep in that valley, I'm going to start finding the flexor digitorum superficialis attachment. Much of that muscle is on the pericardium channel. I associate it with the pericardium channel, but I'm at its radial attachment. I'm going to strum through that. I'm going to strum through the attachment of pronator teres. Pronator teres, much of that muscle is on the pericardium channel, but I'm going to be at the attachments on the radial side. Continue along that septum, much more into the brachioradialis here, back up to lung 5. So I can feel brachialis, follow up brachialis, deep to the biceps. That's what I'm going to be pressing on when I'm in that little groove. That's going to be angling towards the deltoid tuberosity, and it's going to at least fascially link with the deltoids. So as I get up a little higher, I'm going to start noticing that I can still feel the biceps on my edge, on the edge of my palpation, but I start running into deltoids, especially that anterior deltoid. It's a little bit sore on me. As I strum there, I can feel little local twitch responses, so probably would be useful to have some treatment there. But I'm pretty much on an extra point, John A. Ling. That's the motor entry point for the anterior deltoids. I kind of see it as an honorary lung channel point. It's not, it's an extra point, but it's in that sinew trajectory of the lung channel. So I'm going to pass through it, work up towards the chest, clavipectoral triangle. I'm going to note the clavicular head of the pectoralis major, coming from clavicle down towards the humerus. So I can strum across that. That's part of the lung channel. I can find the coracoid process and feel for the pec minor running down towards ribs 3, 4, and 5. So pec minor, part of the lung channel, a deeper structure than the clavicular head of the pectoralis major, all part of the lung channel though, all in that trajectory, all tissues I see associated with the lung channel. So that would take me up to the last point, lung 1, that's on the lung channel, but the sinews are going to continue up into the neck, associated with the anterior scalenes, and then associated with the brachial plexus that's coming out between the anterior and middle scalenes. So I can press into anterior scalenes. I want to be delicate. I'm going to go through the clavicular fibers of the SCM, and I'm going to feel some density there. I can kind of know I'm on that muscle if I take a deep breath in. And I feel that muscle contract, particularly towards the end of the breath. Some people, that muscle is a little too jumpy, and the minute they take a breath, it kind of contracts. That's probably not a great sign. Maybe too much tension in that muscle, maybe not particularly good breathing patterns. Some people, it doesn't activate much at all. So you want it to do something. I kind of like to see it activate a little bit towards the end of the breath, because it's an accessory breathing muscle, so towards that end of the breath, as I have more demands on my chest, it starts lifting the upper ribs. I can feel the tone of that muscle change. I know I'm on the anterior scalenes. Be careful. Don't press too hard if you're not familiar with this area. It's fairly forgiving, but at the same time, I don't want to jab my finger in and push on the brachial plexus and cause damage to this region. But I just want to take note of it. Note the tension. It might refer into the chest, down into the shoulder, towards the back, down the arm. It's a fairly sensory-rich area on people, and it can be in a big part of various dysfunctions like thoracic outlet syndrome. So just take note of it. Take note it's an accessory breathing muscle associated with the lung channel, as is the pec minor. That's an accessory breathing muscle, helps lift the upper ribs. That's associated with the lung channel. The clavicular head of the pectoralis major, anterior deltoids, biceps, especially that outer lateral head, but also the short head, to be honest. It's long head and short head are part of the lung channel. Brachialis muscle, deep to the biceps. Brachioradialis, especially those more anterior fibers. Flexor carpi radialis muscle. Some attachments, but particularly the flexor pollicis longus muscle, down to the wrist. The last thing we didn't cover are the thenar muscles. So there's several thenar muscles here, part of the lung channel. Lung 10 would be in that area, and then that would follow down into the tendons to end the lung channel at the radial side of the end of the fingernail.